Good morning, y'all, and welcome to Need to Know. Today we are talking about some new numbers released by the Centers for Disease Control and Prevention on measles in the U.S. Let's get started. So first I want to apologize. Usually I do have my face on the screen as well as the fun baking scenes. But today I'm not doing that because it got a little dark on me a little early and I cannot find my light. So you're just going to hear my voice while watching the tranquil baking videos. So I hope that's okay. And we're talking about some serious stuff today, so please bear with me. So today we're talking about the CDC released new data on Friday regarding measles in the US. So more cases of measles have been confirmed in 2026 than in all of 2025. And we still have, 5 months left of 2026? What month is it? It's July. So August. We're about to hit August, September, October, November, December. So 5 months left of the year, and we've already went over the numbers from last year. So here are the numbers, right? I always like to give data. So as of Thursday of last week, there have been 2,316 confirmed measles cases in the U.S., compared to 2025, which had a total number of 2,289 cases. So this is the highest number of confirmed cases of the disease since 1991. And like I said, we still have some time left this year. 93% of these cases presented in people who were either unvaccinated or their vaccination status was unknown, and they didn't, or at least I didn't see numbers to distinguish between that. I wish I had, because I think that's important. But those are the numbers that the CDC provided. But also in 2026, we have not yet had a death from measles, knock on wood. While in 2025, there were 3 deaths attributed to the disease. So we haven't had a death yet. So that's good, at least. And the most hard hit states so far with the amount of cases are South Carolina and Utah. So there's that. That is some pretty bad news today. So why is this important? So health officials are attributing the rise in cases to a lack of vaccinations, and they are encouraging the public to vaccinate children with the measles, mumps, and rubella vaccine, or the MMR vaccine, and is completely safe and effective. Vaccination rates in kindergarten students have declined significantly over the past 3 school years by 3%, leaving around 286,000 kindergartners at risk. So 3% does not sound like a big number. And 286,000, like there's a lot of people in this country. So 286,000 might not even seem like a large number to you. But I think the concern is more around the lack of trust with health officials and the lack of trust of these vaccines that have been in effect for a very long time and have been proven effective for a very long time. So I would like to say, I know a lot of this is scary. I can't imagine having a child and be given so much information about what keeps them safe and what doesn't keep them safe and everything like that. And there's a million different people telling you a million different things, and it can be a lot and it can be overwhelming. I would like to say that for me personally, I like to take advice from the experts, particularly experts I know, like my doctor. So if you're feeling uncertain, I think the best thing to do is to talk to a healthcare professional, talk to your family doctor, talk to a nurse practitioner that you know, talk to somebody who can advise you on these things, because I believe that is probably the only people that you can, like, you feel like you know and that you can trust themselves. I mean, I can't sit here and be like, the vaccine is safe, be safe. I'm not even a healthcare professional, right? So definitely talk to your doctor and see what they have to say, and maybe get a couple of different opinions. Doctors are people too. So maybe that is what you need to do to feel like you're making the right decision. So yeah, hopefully that makes you feel a little bit better. Hopefully we can move forward and people can regain their trust in the healthcare system, and the healthcare system can continue to improve and be more equitable and help people get the care that they need. So that's our story this week. It's going to be a short episode this week. I'm trying to be better about not talking for like 30 minutes on a topic. So we're going to move on to what will people be talking about this week? What do you need to know? What should you be looking out for? And I have two things that are going to be going on this week that you should probably keep an eye on. One is the Federal Reserve will have a decision on Wednesday about the interest rates. That is something that a lot of people are going to be looking at to see if the Federal Reserve will decide to change the interest rates or not. And I might do our next episode on this, depending on what they decide and what that means for us as consumers and for our country in general. So be on the lookout for that. That might be next week's episode, since that's happening this week. The other story that you should be aware of is that there is some extreme heat covering our country. If you're like me, you are sweating right now because it is hot, and it is potentially going to be really hot this week. So of course, weather can always change, but just be careful. Be aware that it's going to be hot. Be drinking a lot of water. Make sure that if you know anybody who does not have access to air conditioning, like, be a friend and let them come over for a couple of hours during the heat of the day, because it's going to get hot this week and we all need to be looking out for each other. So those are some things that you need to know for this week that's going to happen this week. And that's it for today's episode of Need to Know. Thank you so much for spending some time with me today. I'm sorry again that I could not put my face in front of you. It is literally getting dark right now. I took too much time doing other stuff today, so could not get in front of the camera today. But I mean, hopefully my voice is good enough. I don't think you necessarily need to see my face, but you know, it's not like I do it up or anything. So yeah, if you like this video, if you like receiving your news this way, please like and subscribe. You can also find me on Instagram for some behind the scenes action, and you can also support my work directly on Substack. So I want to keep as much of this content free as I can, but I also need to be able to eat and pay bills. So if you have the means, please subscribe on Substack. And as you start your week, just remember, you are alive, you are whole, and you are here. I'll see you next time on Need the News.